Walking is one of the most ancient forms of physical activity, and for many people with type 2 diabetes, it could be the simplest first step towards making beneficial lifestyle changes. Today I'm going to discuss how walking can help improve type 2 diabetes and boost mental health. And I'm also going to touch on special considerations for walking, like walking HIIT workouts, motivation, and exercise snacks. I'm Dr. Elise Brown, and I'm a scientist who studies how exercise can help prevent and slow the progression of type 2 diabetes. There are many reasons why people with type 2 diabetes might find it challenging to meet the current exercise guidelines. Some of these reasons could include higher levels of fatigue, concerns about blood sugar dropping too low, unique physical challenges. Their doctor may have not provided them with sufficient information about how to improve their diabetes through exercise. They may not be receiving enough support from their healthcare system, or they may live in an area where there's not very many exercise facilities. Walking is one of the most popular forms of exercise in people with type 2 diabetes. This is because it's relatively low impact, it's relatively safe, it can be varied by speed or incline, and it doesn't require any type of specialized skills. In people with type 2 diabetes, one walking session can reduce blood sugar, boost mood and general feelings of well-being, and it can improve arterial stiffness, which is related to heart health. Even though one single session of walking at a moderate intensity for 30 minutes can reduce blood sugar can be reduced more substantially if this 30-minute walking session is done in a HIIT format or a high-intensity interval training format. So what this would look like, you would do 3 minutes of fast walking, which would be at a high intensity. Then you would do 3 minutes of slower walking at a low intensity, and you continue to alternate between this high intensity and this low intensity for 30 minutes. Now, if somebody's wanting to get involved in HIIT training and they have type 2 diabetes, they first need to make sure that they've been doing moderate intensity exercise and they have been cleared by their doctor to do so. Now, it's important that you also make sure that you include a 5-minute warm-up, so you'd be walking at a lighter intensity, and you would end the workout with a 5-minute cool down. The benefits yielded from a single walking session are exciting, but the advantages are going to be much more substantial whenever the walking is done on a regular basis. In walking programs that lasted at least 8 weeks that involved walking 3 to 5 days a week at a moderate intensity and accumulating at least 120 to 150 minutes per week, these types of programs resulted on average in a decrease of A1C of 0.5%, a decrease in diastolic blood pressure of 1.97 millimeters of mercury, and a decrease in body mass index, or BMI, of 0.91 kg per meter squared. And all of this occurred without any changes in diet. Now, of course, if we make other changes to our lifestyle, like appropriate dietary modifications, or include other types of exercise like strength training, we can expect to see more substantial results. But it's still really encouraging knowing that if somebody is wanting to start lifestyle changes, all they really have to do is start walking for a few weeks, or a couple of months, and they can expect to see benefits quite quickly. There are a few things that should be kept in mind when starting a walking program for diabetes. People tend to be most successful in these walking programs whenever they're being supervised by an exercise professional, but it's not realistic for a lot of people to hire a personal trainer. Now, many insurance companies will cover diabetes lifestyle programs, which sometimes includes working with an exercise specialist. It's worth checking with your insurance company to see what's covered. Even if you decide to start a walking program on your own, using motivational tools like step counters, activity monitors like a smartwatch, or support from family and friends can help you to meet your walking goals. If you're not quite certain that you're ready to start a structured exercise program, you might want to consider starting off with exercise snacks, which involves breaking up your sitting throughout the day with 3 minutes of light activity. Sitting for long periods of time throughout the day increases the risk of developing more diabetes complications, heart complications, and risk of early death. The way that this would look is every 30 minutes, you would walk for 3 minutes at a light pace, and you would do this 12 times throughout the day. This has been shown to reduce insulin levels by 36% and blood sugar by 39%. And the benefits are fairly similar whenever you break up your sitting throughout the day with 3 minutes of muscle strengthening exercises rather than walking. Starting a new exercise program can be intimidating at first, and walking may be a more comfortable way to ease into that new exercise routine. Even though one exercise session can reduce blood sugar and it can also boost your mental health, more substantial benefits are going to come whenever you're doing the walking on a regular basis. If it's right for you, consider HIIT workouts that involve walking. Make sure that you're using motivational tools. And also, if you're not ready to start a full-on exercise program, consider starting with exercise snacks. Thank you for watching.